Hello. In this video, we will learn how to correctly perform clean intermittent catheterization, or CIC. Your provider has asked you to perform CIC because your bladder does not empty the way that it should. CIC is an easy way to empty your bladder and decrease the chance of getting a bladder infection or injuring your kidneys. This may need to be done every 4 to 6 hours. Your medical team will help develop a schedule that is right for you. CIC is a skill that is easily learned with practice and repetition. You will need to catheterize yourself often enough to keep the amount of urine drained below 300 mL, or about 8 ounces. It is essential to establish a daily routine. Using a diary to keep track of the number of times and amount urine voided will help you establish that daily routine. You should plan to perform catheterization in the bathroom. Before performing CIC, you'll need to gather the appropriate supplies. First, you'll need a catheter. Catheters come in different lengths and sizes. Some catheters are pre-lubricated, and those catheters do not require the application of gel lubricant. Others might require a water-soluble lubrication to help provide comfort and ease with insertion. It's very important that you do not use petroleum-based products on the catheters. Second, you'll need an antibacterial soap and water to wash your hands and a clean towel to dry them. Additionally, you'll need a moist towelette or washcloth to clean the opening of the urethra that connects to the bladder, as well as cleaning the areas around it in the vagina. Third, you'll need a toilet or urinal basin for urine draining. You'll also need a clean, flat surface on which to lay your supplies. When first learning CIC, it may be helpful to have a mirror to help locate the urethral opening. To catheterize, start by washing your hands with warm water and soap and dry with a clean towel. You can use gloves after washing your hands if you choose. Place your supplies on a clean surface that can be easily reached. Position yourself with your knees apart or with one foot resting on the toilet seat facing the toilet. Clean the area around the vagina and opening of the urethra with a moist towelette or washcloth in a front to back fashion. Using your non-dominant hand, spread the folds of skin on either side of the urethra opening and vagina apart using your first and third finger. Find the opening with your middle finger. Finding the opening can be aided by placing a mirror between your legs. Using your other hand, gently insert the lubricated catheter through the opening in an upward direction. Take care not to touch the tip of the catheter on any surface prior to insertion, as to avoid contamination. Once you see the flow of urine, insert the catheter 1 more inch. The toilet or urinal should be lower than the bladder to aid in drainage of urine. Once the urine flow stops, slowly remove and discard the catheter. Wipe the vaginal area with a clean washcloth from front to back to clean the excess lubricant. When finished, wash your hands with soap and water. Call your doctor if you have any trouble passing the catheter into your bladder or if you are unable to empty your bladder completely. If you develop any signs of infection, including fever, chills, nausea, vomiting, or increased bladder spasms, notify your doctor immediately and increase your fluid intake. If you increase your fluid intake, it is important that you remember that you need to increase the frequency in which you perform CIC. CIC may seem difficult at first, but is easily learned with practice. If you have difficulty performing CIC, please contact your provider.